This is Amanda Marcotte with RH Reality Check, and we're here at Netroots Nation to ask people what they think about reproductive rights and access.
I do consider myself pro-choice. I think the right to have an abortion is something that's up to the woman, and isn't something that the government should be legislating.
I definitely consider myself pro-choice. I mean, it's one of the basic, liberties that people have. Is this, women have to have control over their own bodies.
I absolutely consider myself pro-choice because I think that regardless of my personal beliefs about abortion, I think it's really important that everyone gets to have their own belief about abortions.
I am pro-choice, and a large part of the reason is I grew up in a house with two women.
Oh, I'm unquestionably pro-choice.
Oh, I definitely consider myself pro-choice.
I do consider myself pro-choice.
Absolutely pro-choice.
I consider myself pro-choice in everything, really. So it only makes sense that it extends to reproductive rights as well. Why? Because it's each of our individual lives and choices that, should be up to us. There's an extent to which regulation and governmental involvement in personal lives is too far. And unfortunately, I think, right now, there's too much of a presence and support for overextension of regulation, if you will, into people's individual lives.
I think it's pretty scary. I think that we like to say certain things are legal, but it's actually not better than it was in 1973. Because I'm privileged and live I'm originally from New Jersey and live in DC now, so I have access and that I can get to things. I have money, so I can get to health care and reproductive help if I need it, but many, many women in this country and around the world can't do that at all. So I think it's really sad. And men, and really anyone who needs sexual services. It's a bad state of affairs these days.
I actually grew up in South Dakota, and there's currently the ballot initiative that's happening to outlaw abortion in South Dakota, with a few exceptions that they have that aren't really exceptions, in my opinion. The unfortunate thing is, for all intents and purposes, it almost is outlawed already because no one is really willing to practice there.
We're leaning more and more conservative on this issue, regardless of what's best for women and what's healthiest for our country, and so I have a lot of concern, actually.
The reason why this year we had the first uptick in more than 2 decades in teenage pregnancies is because of this administration's continued efforts to reduce that teaching of safe-sex practices.
The big problem is that we have one political party in this country, the Republican Party, that is fundamentally anti-health, and they take a lot of steps that endanger not only women's lives but children's lives too, in order to prevent something that has far more reaching effects than even they think it does.
It's oftentimes an issue that I don't think gets as much play, as much attention as it probably should. The next president is going to get to appoint at least 2 more justices, possibly in his first term. So it is an issue that I think needs to get a lot more coverage than it currently does. So
I think it's still framed in a way that doesn't necessarily consider the complexities of the argument.
I think it's really skewed because I think our opponents have done a really good job of making it an issue about fetal rights and the viability of a child. And I think the argument needs to be shifting towards the rights of the woman and the mother, and whether the government should be making these decisions, which are very private and personal, about not only her health but also her constitutional rights.
The facts and the sort of correct ideology is on the pro-choice side. And I don't feel as if it's covered honestly. I feel as if it's covered too much towards that balance, that false sense of balance.
I think the media is doing it largely for theater, not actually because they have any opinion or they even really research or think about what they're asking. I think it makes, a good stage production for them.
I think that it would be great if at the federal level they said that we have a right to abortion and not trying to this kind of snowball effect of what they're trying to do right now with trying to take away those rights. I think also there needs to be change, like I said before, with education and trying to have sex education not be abstinence only.
I'd like to see candidates and congressmen and senators and the president, the next president, really do better on increasing access to reproductive health and reproductive freedom.
Oh, I would hope there would be a whole range of coverages as it pertains to kind of the general topic of sex, whether it's reproductive rights, whether it's birth control, the whole 9 yards.
I think Congress should pass the REAL Act, which is the Real Education About Life Act, that would open up funding for comprehensive sex education, which we have very, very little of and is being threatened intensely in America. I think that should happen because it's proven that works, and when 1 in 4 teenagers has an STD or STI, and we have things like the pregnancy pact or whatever's happening, teen pregnancy rates are going up. I think it's definitely necessary. Birth control should absolutely be covered by healthcare plans, because I know I take birth control pills for a medical reason, and it's not covered. So those kind of things, just make sure that I can get access to what I need and the people around here can too.